Do you suffer with congestive heart failure? I have right-sided congestive heart failure. So we can help you naturally, and we offer you a money-back guarantee to prove it. Hi everyone, I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983, so almost 40 years in natural health care. 40. I'm the author of this book, You Can Beat Thyroid Disorders Naturally. I'm the author of this book, What Do You Do When the Medications Don't Work? And I'm going to start off, I'm going to show you my BNP. Because BNP, as you know, is a marker for congestive heart failure. Then I'm going to tell you what happened. Not good. So my BNP got up to 1200. Anything over 900 is severe heart failure. Now, this is when it came down. This is the end of January, January 31st of 2022. And you can see right there, 1,024. So it had come down a little bit, but it's still high. And let me tell you how I got there. So I have emergency gallbladder surgery. I go in for the surgery and I have severe pneumonia. They give me too much Lasix. It caused severe kidney failure. My kidney function went down to 26%. Here it is, the GFR is like at 32. And my homocysteines at 24. Normal is 6 to 7. GFR should be as close to 100 as possible. By the way, if you don't know anything about BNP, and maybe you don't, it should be less than 100. You saw it was 1024 there. So I go in, they give me too much Lasix, I have the surgery, they come back and do more blood work. So I had blood work on Wednesday, do the surgery Thursday, come back Friday, they do more blood work just to check me, and I just am a wreck. Severe kidney failure, severe heart failure. Prior to the surgery, my BNP was 60. My ejection fraction was fine. And my ejection fraction has been good all along because it's not left-sided heart failure, it's right-sided heart failure, which they can't do anything for. So having it makes me the expert. And that's why I say if we accept your case, we offer you a money-back guarantee. So what happened? Now, where you at? It's November 15th. And let me show you the latest lab work. That was from Quest Labs. You can see that. So this isn't fudged. You know, I had an endocrinologist tell me, oh, he's making up those numbers. Really? Labs don't make up numbers. There's only two major labs, LabCorp and Quest. And this is LabCorp, you can see that. And look where it's at now. How now, brown cow, 244. That's pretty darn good. And it was 607 back in September. So it had gone from 1024 to 600. Now it's at 244. And I feel great. But what they also did was they nicked my liver, and there's a nodule, and I had severe ascites, and I had cachexia, and they thought I had cancer, so they're running all these cancer tests on me. It was all clear. Thank God it was all clear. So you see this picture right there? Just to get off track. That's Bayfield, Wisconsin. We have a home up in Bayfield, Wisconsin. This past year, I was so sick, I could not go up to our home in Bayfield, Wisconsin. I mean, I just barely made it through the day. So that's why I say when we take you on as a patient, if we do, because we don't accept all patients, and I'll get into why here in a minute, we expect to get you better. It's going to take some work. It's a 12-month program. You know, this isn't going to go away overnight. It's serious. But you just saw how I made changes in that BNP. So how do we do that? Well, we have you do an at-home therapy with a laser. And you're going to do it over your heart. You're going to do it over your brain. And it doesn't take long, maybe 5-6 minutes here, you know, just for the both of them. But you'll do it 3 times a day. So you're doing something every day to help your heart. every day. We're going to have you do some therapies here at our office in Appleton, Wisconsin. If you're a local patient, if you're a distance patient, now we get patients from all over the country, literally all over the world. They're referred to us. Lately, we've had a ton of referrals, so I haven't done much video on the internet. But a lot of them will come from video on the internet. So we've just expanded our operation, so that's why I'm doing the videos. We've hired more staff. We've ramped it up. So at-home therapies, possibly clinic therapies, unless you are a distance patient, and complete blood work. I just saw, you saw some of the blood work we do, but we do everything. I mean, yeah, we really look at you. Now, I know you've never heard of this. This can cause heart failure. I know your MDs are not talking to you about it, your cardiologists, your internists, whoever you're working with, because nobody talked to me about it and they don't know about it. High ferritin levels, high stored iron, iron overload. Iron overload can cause heart failure. So normal ferritin level is 20 to 50. Mine was 350. We've seen people 500, 1,000, 2,000. Until you get those iron stores down, and you can naturally, guess what? This heart problem you're having isn't going away. The heart failure is going to be with you. It's not going away. So we can help you with that. Next, we need to remove toxins and infections, especially if you got it in the heart. Next, we need to get you off cheap, inferior vitamins. I mean, if you're taking supplements, vitamins from Walmart or Costco or Amazon, the B vitamins they use are made from petroleum products. That's making your liver worse. That's affecting your heart. If you're taking vitamin D, it's made from sheep's wool. It's affecting your heart adversely. So slowly over time, you're hurting yourself. You think you're saving a couple bucks, you get what you pay for with nutritional supplements. Get off of that crap. Seriously. Man, people don't realize what they're doing to their bodies. You're going to have to change your lifestyle. If you're eating a lot of refined sugar, if you're eating a lot of junk food, we've had patients, they're drinking 12-pack of Diet Coke a day, 12-pack of Diet Mountain Dew a day. You got to stop. And if you don't want to make changes, that's okay. You don't want to do the home therapies, don't contact me. Don't email me. We won't accept you. If you're a smoker and you have congestive heart failure, shut this video off right now. You're wasting your time. You're not serious about your health. I will not accept a smoker because they are not serious about their health. You have to have quit smoking for at least a year. Oh, I've quit for 6 months. Good. Wait another 6 months and contact me. We don't accept all patients. Do you know how many inquiries I get in the day? Probably 100. Easily. I should count them. Now, I have a staff person that helps me with that. How do you think I'm making a video like this? So she filters through and said, nope, yeah, over here. Nope, yeah, over here. So that's the first thing we do, because we send you a questionnaire. And so it just says, are you willing to make lifestyle changes? Yes or no? Are you a smoker? Yes or no? Just simple things. It's not complicated. And then we go from there. Then we'll set up a consultation, and then we'll see if we accept you as a patient in our clinic. Because we only accept those patients we truly feel we can help. That's why we are so selective. That's how we can offer the money-back guarantee. If at the end of 12 months, you aren't at least 70% better, and you saw I was better, and so we use markers, then for sure, we're going to give you your money back. And we put it in writing so you can hold us to it. So lifestyle change is very important. We don't accept everyone into the program. We offer the money-back guarantee. If you're interested, email me, drmlj@gmail.com. That's drmlj@gmail.com.